Hey everyone, and welcome to the Balanced Bodies Blueprint. I am your host, Vinny Russo.
And I'm your co-host, Dr. Eryn Stansfield.
And we're shifting gears from all the conventional fitness narrative you hear on most fitness podcasts, as our main emphasis lies in preventative healthcare, adopting a holistic approach to nutrition, and challenging the traditional views on various fitness topics.
Our mission with this podcast is to provide you with the information you need to achieve optimal health.
And on today's podcast, we are going to have Dr. Eryn do a nice deep dive into something that she is actually a very well-informed expert on, because she deals with it on a daily basis. And we are going to be talking about heavy metal testing. This is a big thing right now. So, Dr. Eryn, just, what's the deal with this? Why is it such a big thing? Is there any validity to heavy metal testings in general? And why is it even a thing?
Well, I didn't know it was a thing until I heard of functional providers doing heavy metal testing or heavy metal blood panels. And so I thought this was, so I learned a lot about this in my residency because we deal with this on a daily basis. I worked for the Air Force, and so we actually have workers that are exposed to toxic metals. So the very first brush I had with it was with workers coming in and bringing blood panels from outside providers to our Air Force base saying that they got tested for heavy metals. That was my first brush with it. And I thought, well, maybe this is just a thing amongst some of the workers because they're trying to confirm that they're not having toxic exposures at work. And so they're going off base to get tested by these other providers. But then I started hearing this thing with some of our clients and patients saying that a functional provider had told them that they had heavy metal toxicity and they got some kind of blood panel. So that was my first brush, and it kind of made me cringe when I heard that.
So it is safe to say, though, that because you deal with this working on the Air Force, that you are an expert in dealing with toxicity with heavy metals.
Yeah, so I've worked for the Air Force for about 15 years now, and my residency dealt with this. It is in my wheelhouse, right? So a lot of our workers at in the aviation industry in particular do have certain toxic exposures, and we follow federal guidelines, i.e. OSHA, that help guide, one, the levels of exposure that are called PELs, the permissible exposure limits, to the workers. And then there are certain surveillance programs that are federally mandated, essentially, that are law, that require surveillance. And part of that surveillance is medical surveillance. And part of that medical surveillance, depending on what the exposure is, may require some kind of blood testing and urine testing. And so I'm very familiar with the kind of testing that is out there and also the testing that is validated.
Yeah. So can you explain the role of OSHA in guiding these tests?
Yeah. So, back in the 1970s, because of worker injuries and potential exposures to workers, OSHA became an entity that started regulating some of these toxic exposures besides injuries. And they came out, like I said, with permissible exposure levels for workers, saying that employers are required to protect their employees. And thus there were certain toxic metals, if you will, that have some kind of OSHA regulation associated with them. And these are, if you don't follow them as an employer, you're violating the law, and OSHA can come cite you for it. A lot of the metals that have this kind of legal requirement have what we call OSHA expanded standards, essentially, because it's a little bit more than just, making sure that the worker is safe. There's actually medical surveillance, like I mentioned previously. So there are typically annual exams. There's PPE, personal protective equipment, that the worker has to wear in order to minimize their exposure. Usually, like a bioengineer will try to engineer out the hazard. So if there's a way for the exposure not to occur, that is the best way to control the exposure. But then if the exposure does have to happen, there's certain personal protective equipment that the worker must use. And then as far as the medical surveillance piece, then there's you typically annual to biannual exams depending on what the exposure is, and then there's specific testing for different metals depending on what their exposure is and how much of the exposure they're getting per year. And usually we look at the 8-hour total weighted average. We work very closely with bioengineers, industrial hygienists to kind of assess the risks out there. And this is an ongoing thing. We are constantly surveilling. We're constantly looking at exposures. We're constantly doing testing.
Yeah, you definitely are an expert in that, and thank you for that rundown. It's pretty cool too, because as a company with balanced bodies, we are trying to expand out and tap ourselves into the whole corporate field. And one of the benefits of working with us for those corporates is that you make sure that everything's OSHA compliant with that
Correct.
company,
Yeah.
which is
Yeah.
pretty cool. But honestly, I mean, you mentioned functional practitioners right in the beginning. You kind of smiled. Honestly, with all of, especially the more well-known functional practitioners now talking a lot of nonsense about doctors in general. I want you to take off the gloves here and just feel okay to say what you have to say, because they don't hold back when they talk about doctors. But going back to them, what are the heavy metals that they even try to test for?
So, um, obviously, I can't speak for a functional provider. I don't practice functional medicine, if you can even call it medicine. Um, but I did ask around, and just speaking to patients, what I've seen is that the functional providers are running blood tests, blood panels for things like mercury, arsenic, lead, um, sometimes aluminum, chrome, um, and cadmium.
Well, can you even test for these heavy metals with blood?
So it depends. So my favorite one is when a patient comes to me and says that they've been tested for chromium. And so my first question is, what species of chromium? Chromium 3 or 6, or what did you get tested for?
So there's a bunch of different so there's different levels to the metals.
Well, there's different species,
Yeah.
right? So there's different valences as we learn in elemental or chemistry, that these different metals have different states.
Mhm.
So there's chrome 3 and chrome 6. Chrome 6 is the one that we worry about in the industrial setting because they're in paint products, for example. But my favorite thing is when they say, I got a blood test for, most of the time they don't know what kind of chrome, but if it is chrome 6, they'll say, I got a blood test for chrome 6. And there is no normal level for chrome 6. Now, if you go to a chrome lab or something like that, they'll give you a range, but that range really hasn't been verified. And we know this because most of the studies have been done in animals and they haven't really verified in humans, like what a normal range of chrome 6 is, for example, because it's all over the environment. So in our workers, for example, we look at their exposure level and their personal protective equipment, but we don't blood test for chrome 6. And the reason is we look at the exposure and then what those long-term effects of that particular exposure are. And I can tell you that the chrome levels in blood are not going to reflect the long-term exposures. The long-term exposure for chrome 6, for example, is going to be lung cancer. So we're not going to blood test for you. We're going to look at other things. We're going to look at, and we look at skin ulcerations, that sort of thing, because it can be a skin irritant and nose irritant. And we look at your pulmonary function. So that's going to guide what we look at clinically, not a blood test, because there is no normal for chrome 6.
Yeah, and if you said like it's that prevalent in the environment and you're around it, might be in your blood. And if there's a
Yeah.
little bit in your blood, they might say, oh, look, you have heavy metal
Yeah.
toxicity.
Right. Exactly.
Yeah.
And there is no, you can't really verify that because, like I said, there is no verified normal level.
Well, what about something like cadmium? Because I actually heard someone on, I think it was definitely Instagram, someone on Instagram saying that you should get tested for this. What, so I got to ask you, like, is there a blood test for cadmium? Like, what do you do with that?
Yeah, so there is blood tests. Cadmium is one of the few that there's blood test, but also there's so much more than that. So when you look at any of these heavy metals, which is my biggest pet peeve, right, with these functional providers doing this, is you look at the person and then the exposure. And part of that clinical picture is what they're doing, where their exposure might be. And then the reason that we actually work with industrial hygienists is because they actually go look at the environment that they're exposed to, and they measure how much of that toxicity or that toxic metal that they might be exposed to. Okay. So there's a whole exposure history that's missing there. And I think that's the biggest thing with these providers is somebody in the general population in general is not going to be exposed to these toxic metals at a toxic level. And so they don't need to be getting blood tests for this. It's usually specific industries. And we'll talk about the two exceptions to that. But it's usually specific industries that you're going to test for this. So you need to look at the patient, the clinical picture, and then recommend the type of testing, but also evaluate their environment and what kind of exposure they're getting, not just throw some blood test and say you have a toxicity to so-and-so. And I will tell you that most of the general population does not have these toxicities.
Yeah. Now, let's just say you do get tested for the cadmium and you got a blood test and it happened to be in a range and a functional provider said, well, look, you have this in your blood. You're getting some type of toxicity. What are there other tests that you would do to verify that there is toxicity? Like if someone had a high range in their blood or
100%. So what I would look at is one, if they actually are getting exposed, like what's their exposure history? And again, you'd work with an industrial hygienist to get that level, but you'd look at their clinical picture. And then cadmium affects so many organ systems. So you not only would you look at it in the blood, but you'd look at it in the urine. There's specific carrier proteins, beta-2 microglobulin that carries it in your kidney. So you're looking at very specific carriers and proteins in the kidney. Plus, you're going to look at other organ systems. It can cause anemia, so you're going to look at a complete blood count. It can cause lung issues. You're going to evaluate their lung function and cause prostate issues, so you're going to get PSA. There's so many other organ systems that it can affect. And so you're actually going to get further testing, not just a blood test. There's urine involved. There's other tests that are involved. Typically, even a chest x-ray can be valuable in this case.
oh yeah, it just seems like trying to just put a blanket answer with a blood test really doesn't do anybody justice. If anything, it puts fear into that person to try to get help.
Well, and I think that's exactly what the motivation is. Like I said, I'm not a functional provider, so I'm not going to speak to them, but what I do see is that a lot of functional providers will then say, you have some kind of metal toxicity, let's try chelation. And I think that is bordering on malpractice. If somebody's telling you that, I would definitely get a second opinion from an expert that's not trained in functional medicine. Somebody who knows what they're doing. Like I said, there's a huge clinical picture here, and chelation therapy is a therapy. It's an actual therapy. And so you don't want to actually do this kind of therapy unless you actually have an issue that is causing a problem. And I wouldn't trust a functional provider to tell me to do some blood panel and then tell me I have an issue.
Yeah. Yeah. And I think that's a valid point. And it's really like if you get scared into something like heavy metal toxicity from a provider, you should always go, and it's not so much a second opinion, it's more or less like dive even further with an expert, like someone who is really good at the one thing that they're supposed to be doing, not decent at pretty much everything on the plate, right?
Well, and the other thing I'm going to say is that a lot of these functional providers will chalk vague symptoms or like even GI symptoms up to some of these heavy metal toxicities, which is complete BS. Sorry. Like there's very specific organ systems that these metals affect, and there's very specific findings. And so if you have generalized malaise, I'm not saying don't get tested. I'm just saying the likelihood of it being a heavy metal is very low.
Yeah. Yeah. Well, what I think would make this, because it seems like we could just keep going back and forth here. So what I think would make this episode a little bit more efficient is if you would be able to go through like maybe 3, 4, 5 of these heavy metals one by one, just to really explain to our listeners, the potential toxic effects of these heavy metals, and maybe even when you should actually get tested. I know you listed off like 5 or 6 before. There's 2 of them that really stuck out to me. The first one being lead. I believe this is something that's pretty serious, especially in children. So can you
Yeah.
elaborate on this?
So the 2 metals that I think are important that clinicians in general medicine, specifically pediatricians, will actually test for is lead, and then not so much pediatricians, but potentially mercury. So let's talk about lead. And I'm kind of going to follow the same format for most of these, but so we worry about lead because the source of exposure used to be paint. So we used to use leaded paints until about 1978, I think it was when it was banned. And the reason that pediatricians would screen for this is because infants or little kids would, they crawl on the floor and they put things in their mouth, and sometimes they would put paint chips in their mouth. And so it was a potential exposure. Again, look at the exposure history. And so this is something that would happen with children a lot. And with children, the lead levels, the reference levels, are a lot lower than, for example, for adults. And the reason is because you can have long-term effects from lead, especially as a child. And it has to do with part of their GI system as well, and how lead is processed through that. But basically, lead follows the same route as calcium, so it can be deposited in the bone for long term, and it can be dangerous in fetal development. So again, it's important for pregnant women also to be very careful about not being exposed to lead or lead products. And sometimes if the child mobilizes their calcium stores, whether that be from growing or whatever, they can potentially have some toxicity from that. And it also, lead exposure is a tetratogen. You can get stillborns, spontaneous abortion, delayed cognitive development. So like I said, pregnant patients should have minimal exposure. In adults, where lead exposure is less common, but can occur. The adult level is less than 10 micrograms per deciliter, is what you want to not be exposed to. And for children, it's 5 micrograms per deciliter. But in adults, it can cause things like kidney problems, nephropathy, hypertension, gout. It can decrease your fertility. And there's a specific kind of nephropathy that it can cause, Fanconi's type 2. Acutely, like if you get acute exposure to lead, if you have let's say you're taking a supplement with lead, which would be terrible, but you can get colic, so stomach pain, and then acute renal failure.
Well, yeah, I mean, if you ever heard the saying, like, some people would refer to like people who are acting dumb or acting stupid, like, would you eat paint chips as a kid? And the reason why is because it could affect
Yeah.
the brain, right?
Yes.
That's the main thing. And if you think about it with children too, it's like it's not only like even how like it gets processed through the GI, it's being different, but children are still growing, right? Their organs are not fully developed. And their exposure compared to adults, they haven't been on this planet long enough to build up any type of immunity or any type of, response to these metals. So it'll affect them so much more. And I think it's a great thing that we got lead out of, gasoline. And we also got it out of the paint that's, within the households today. But you did mention another one, which I mean, I hear a lot about it because I like to provide fish if I can in diet plans. But you mentioned mercury. So why don't we dive into mercury a little bit and tell us, the potential toxic effects and when you think we should get tested for that?
All right. So again, with mercury, you want to look at the source of exposure. And I didn't mention this in lead, but depending on, so, with any of these metals, you got to go back to basic chemistry and you have to separate them out into inorganic, elemental, or organic. So again, it kind of depends like what state the exposure is in. But in general, the sources of exposure are going to be fish, seafood, sometimes the dental work, the dental metal that they use, and some
really old thermometers.
yeah, yeah,
Really, really
yeah,
old
yeah,
thermometers.
yeah.
Yeah.
You don't want to break any of those. And then the industrial processes, not vaccines, not valid. Um, but again, a lot of people worry about mercury poisoning, for example. I'll talk about, let's divide this out into inorganic, elemental, and organic. So inorganic mercury in general will cause different symptoms than, let's say, there's some overlap than elemental or organic, but inorganic causes acute tubular necrosis. So basically it affects your kidneys. It can cause GI necrosis as well. So your GI system. Elemental can cause tremor, and it can cause something called erythrism, which is like a shyness. So it can affect your personality. And then gingivitis. Organic is a lot of the neurological things. So ataxia, spasticity, visual field impairment, and some hearing loss. I think that the biggest case of when we figured out that seafood could be an issue is Minamata Bay in Japan had a major issue with this in the 1940s to 1960s. They had exposed infants. Basically, a bunch of infants were born with cerebral palsy-like symptoms, mental retardation, microcephaly, and what had happened is they had looked at what their exposures were, what the maternal exposures, so their mothers, what they were exposed to, and they found out methyl mercury was released into the water, which was done by a company near where these women would fish and collect the fish to eat. But basically the methyl mercury was absorbed by the plankton and then eaten by small fish and shellfish. And then the larger fish would eat those fish. And so you get this like food chain magnification, if you will.
What it's called biomagnification.
Yeah. And you get this bioaccumulation. And then these fish were then consumed by the population, and they specifically affected pregnant women and these number of babies that were born this way. So again, it doesn't become a problem in fish unless you are doing fishing near a factory or something like that. I feel like for the most part, the FDA kind of regulates, food sources and stuff like that. But it's a pretty rare exposure. But obviously, people are out there testing for it.
Yeah, it's pretty crazy that you brought up the biomagnification. It's something that I taught when I used to teach environmental science. And at each step of that food chain, like it literally goes up tenfold. So when you get near the top of that food chain where the bigger fish would actually be, which is the ones that we're going to catch and eat, that gets into us. And the more we eat it, the more bioaccumulates within us, the more symptoms you see and the more potential risk and hazard you have. Yeah, so lead and mercury, were those the two that you said?
Yes, so these are the ones that, especially in children that people worry about. I think lead could be valid, again, like I said, depending on the area you live in. Like if you live in Boston, for example, where homes are older and where potentially there could be lead paint used, it becomes more of an issue. And a lot of pediatricians are pretty good about screening for lead exposure for children, and then even perhaps during their pregnancy. But beyond that, it's very rare to have lead exposure unless recently, I've seen some issues where they are using lead in some supplements. And so if you suspect that you're having issues because of a supplement you're taking
Are
that,
they knowingly using lead in supplements, or it's just a cross contamination?
well, I can't speak for a supplement company, but
Well, we got,
who
let's
knows
try to
what
give them the benefit of the doubt here.
who knows what's in some of these supplements, but some of them do have medicinal purposes, right? And so you have to be very careful about, again, supplements and where that lead might be coming from. Again, it's rare, but that's the only thing that I could think of for an adult where you might have a potential exposure besides in like unless you're working in a battery factory. Then as a worker, there are industrial processes, lead piping sometimes, obviously with corrosion. So, they saw this in some of the water systems where that are older, the municipal system. So that would be, a source. So you really have to look at like what's the source of exposure for if you're an adult.
Yeah, another reason why you should never, you should properly dispose of all your electronic devices the right way, especially batteries. Just don't throw them out into the grass. But let's just do two more. All right, we got. I know you mentioned three. You said cadmium, arsenic, and chromium. Why don't you just pick two and do a deep dive into those two? We wouldn't really talk about arsenic that much if you want to do that, because arsenic seems to be um, a hot topic of conversation with
Yeah.
toxicity.
All right. So arsenic, so there are different levels of arsenic exposure, and there's even one for drinking water. It's 10 parts per billion. The permissible exposure level, for example, 0.1 milligrams per meter cubed. And if you're looking at it in the air, it's about 0.5 parts per million. So again, you want to look at what kind of arsenic you're being exposed to. Inorganic arsenic is toxic, whereas organic arsenic isn't usually as harmful. And then you want to look at the different effects. So one, again, you want to evaluate the exposure. Is there a real exposure? Make sure you measure the levels of that potential exposure. And then you want to look at the clinical symptoms. So arsenic acutely can cause intravascular hemolysis and ascending peripheral neuropathy. Chronically, it can cause lots of problems, hyperkeratosis, hyperpigmentation, peripheral neuropathy. It's a lot of neurologic issues. It can cause cardiac problems, hepatic problems, angiosarcomas, and it can actually cause lung cancer. I will say, so not all forms of arsenic are toxic. Okay. So arsenobating, I'm not even sure if I'm saying that correctly. But it's found in seafood, for example, and it's non-toxic. So again, speciation, which is determining, if it's organic and inorganic arsenic, is very important. Arsenic 3 and 5 are the bad culprits in general. They bind to sulfohydryl groups. And with arsenic testing, you can look at urine levels. So again, blood testing might not be your best route in this particular case. And again, even with urine levels, you want to get speciation. So you want to know what kind of arsenic they're being exposed to. So, and there are specific treatments if you suspect arsenic poisoning. Now, for an adult, again, I'm going to say that unless you suspect somebody poisoning you or some medication that you're taking that's not, FDA approved, then potentially something like this could happen. But in general, you're not going to be exposed to a toxic level of arsenic.
Got it. What's the last one that you feel like going over?
Um, well, we briefly touched on Chrome 6. I like Chrome 6 because it is used in industrial settings. And like I said, you have to look at the speciation of not speciation, excuse me, what kind of chrome you're being exposed to. Is it 3 or 6? 6 is in general used in more in industrial processes, whereas it used in paint primers usually. And it is common. They've mostly tried to do away with it in a lot of the paints, but we see this in the car industry and avionics. If you do a lot of painting, potentially could be exposed. But again, you don't want to get a blood level for this. There is no verified normal. So the best way to monitor for this is what's the exposure level, what level are you getting exposed, and then what organ systems are going to be affected. And usually it's the skin and any soft tissue surfaces or cartilage that can cause nasal ulceration or nasal septal perforations, and then ulcerations in your skin if you don't use any kind of protection with your skin. And then the big one is it can cause lung cancer. So you're going to want to protect your respiratory system. If, for example, you are painting, you want to wear a respirator.
Okay. Now, I cut you off a little bit before when you were talking about mercury, because we started talking about the biomagnification, but you were going into the difference between inorganic, elemental, and
Yeah.
organic. I don't know if you lost your train of thought. Do you want to touch back on that, or?
No, I think I covered most of it, unless you had specific questions.
No, no, that was it. Well, I do have a specific question for you. Why do you think these functional practitioners push this issue so much now, when there's really no validity to it besides when you're talking about like lead or mercury?
Well, I think again, I'm not a functional provider, so I'm not going to pretend to assume their motives. But from an outsider's perspective, I would assume that it's because there is treatment. So like if you can say that somebody has some toxic metal exposure, there is a treatment for it, right? And so they can charge for that treatment. And then also, I think a lot of people with vague symptoms are looking for answers. They want to know what's wrong with them. And so they go to these providers looking for answers. Maybe that traditional medicine hasn't answered for them. And so they're frustrated. And then imagine like being a patient and then somebody saying, I did find something wrong and now we can treat it. And I think that that's terrible because it's not necessarily what's wrong with them. It's just some test that they threw at you that has 0 to no validation. And then they're throwing some treatment that's not going to fix your problem. Maybe it's a placebo effect. Maybe it'll make the person feel better, but also there's harm with treatment. So you can't, I think that is not good practice to throw a treatment at somebody and say, this is the answer to your problem, or this is the answer to your vague symptoms. And that's what disheartens me because, and that's not, that patient's not going to walk away better. They might think they're better for a time, but if their symptoms might come back and they still don't have an answer.
So I would say, and we'll wrap this up, but one big thing that you see everywhere, especially now if you're talking about toxicity, is going through detox programs.
Oh God.
Yeah. So why don't you touch briefly on that? Is there any truth to going through some sort of detox program that could help with heavy metal toxicity?
No. So, I don't know of any detoxification unless you're talking about chelation. And then again, you have to actually have a toxicity. And like I said, if you're in the general population and you're kind of doing the normal things and you're not working in one of these industries where there could be a toxic metal exposure that your employer is going to know about and they're going to regulate, you're not going to have a toxic metal toxicity. Thus, you can't detoxify. And even with chelation therapy, we don't call it detoxifying. So no, that's not valid.
Well, I knew that answer and I just wanted you to say it. So, same thing goes with mold and stuff. But that's a topic for another day. She just rolled her eye. So we're gonna wrap it up here. Dr. Eryn, thank you so much for providing all this information. I honestly feel like people should reach out to you and try to get you on a podcast to talk about this because this is your expertise, this is your wheelhouse, and you deal with it on an everyday basis. If you guys have questions, please feel free to reach out to us both on our Instagrams, or you could go to our website and you could find our emails on there and just reach out and ask us some questions if you feel like you're dealing with any type of heavy metal toxicity, or if you've been through a practitioner who has given you a blood test for heavy metals.
Yes, I would love to hear those stories.
So on behalf of Balanced Bodies, we just want to say thank you for joining us on this episode of the Balanced Bodies Blueprint.
We are committed to bringing valuable content. And if you enjoyed today's episode, we'd greatly appreciate it if you can take a moment and like it and leave a 5-star review.
On Apple, just go to the show, scroll down to the bottom and rate it there. If you're on Spotify, go to the show's page, click the 3 dots, and you can rate it there as well.
And if you believe in the power of knowledge, share this episode on your social media to try and get the information out there to as many people as possible.
And as you navigate your own path towards better health, remember that Balanced Bodies is forever in your corner. See you all next week.
The podcast content may include discussions of medical topics and health-related information. However, the information provided should not be considered exhaustive or complete, and it should not be relied upon as a substitute for professional medical advice or treatment. Always seek the advice of your physician or other qualified healthcare providers with any questions you may have regarding a medical condition or treatment.